Everyone. Today, my topic is the lung compliance, and it is a quite difficult topic, but I've tried to explain it in the easiest way possible. Okay, what is the definition of the lung compliance? Is a change in lung volume per unit change in transmural pressure. Now, what is the transmural pressure? I'll be explaining this later. First of all, you have to understand what is lung compliance. Compliance means the ability of the lung to stretch and expand, and it depends on the two constants. Number one is elastase and number two is stiffness. The both are inversely proportional to the compliance. Now, compliance is inversely proportional to the elasticity, means that if there is an increased elasticity, there will be decreased compliance, and if there is increased stiffness of the material, then there will be decreased compliance. Now, you have to suppose that there is a balloon, and if you fill the balloon with air, then of course that balloon will not hold the air, and that is only because the balloon is too much elastic and the air is not able to be there. Okay, now second example is for the stiffness. If something is really very stiff, for example, if there is a wooden box, it will have a capacity of 4 or 5 further few small boxes, or like 7 books, not more than that. So there is stiffness. That means the wooden box is really stiff and it cannot accumulate more things. Even if you try to compress the things, there will be no place for another thing to. So this is why the stiffness is inversely proportional to the compliance. Now, coming to the transmural pressure. What is the transmural pressure? It is the difference between the inside alveolar and outside intrapleural pressure. Okay, inside and outside. Now this is the lungs. Okay, inside pressure is the alveolar pressure and the outside pressure is the intrapleural pressure. This is pleura, this is lungs, this is alveoli, and you can understand it by this. Is the inner one is the alveoli, the outer one is the intrapleural layer, and the space in between them is the transmural pressure, is having the transmural pressure. Now there is 3 types of transmural pressure. Okay, the first one is the transpulmonary pressure, the second one is the transthoracic pressure, and the third one is the transrespiratory pressure. First of all, you have to understand what is the word trans means. Trans means across. That means transpulmonary means across the lungs. Transthoracic means across the chest, and transrespiratory means across the respiratory system. Okay, starting with the transpulmonary pressure. Transpulmonary pressure is equals to alveolar pressure minus intrapleural pressure. Now, I have tried to explain it in all the 3 conditions. First of all, this is the condition. This is the lungs, this is the alveoli, and this is the condition which is known as the functional residual capacity. That means it is the volume. What is FRC? It is the volume that is inside the lungs after the tidal volume has been expired. Okay, that means this is the lungs, there was a tidal volume which has been expired outside the lung, and now what is inside the lungs? Of course, the residual volume. The residual volume is creating that pressure. Now, at functional residual capacity, the partial pressure of the alveoli, or the pressure of the alveoli, not the partial pressure of the alveoli is 0 centimeter water, and the intrapleural pressure is -5, that is negative. At FRC, this is negative, and if you put it in the formula that we just learned, this, that the transmural pressure is equals to inside pressure minus outside pressure. First you have to keep the inside value, and then you have to subtract it from the outside value from the inside value. Okay, here we are putting the values. The inside pressure is inside. What is inside? Alveoli. The inside pressure is 0, and what is outside? Pleura, intrapleural pressure, which is -5. So minus is plus, and +5 means there is positive pressure. That means towards the lung, keeping it expand. What does that mean? That means the transpulmonary pressure is across the lungs and it is keeping the lungs in expanded form. It is not allowing the lungs to collapse. Okay, this lung is in expanded form. Why? Because the transpulmonary pressure is positive. Only the transpulmonary pressure is positive. And why the transpulmonary pressure is positive? Because the intrapleural pressure is negative. Okay, coming to the next condition. Now this. Here alveolar pressure is 0, but by any chance there is the intrapleural pressure is increased, that is plus 7 centimeter of water. It's just an example. Then putting the values in the equation, transpulmonary pressure is equals to inside minus outside. Inside is 0, outside is plus 7. 0 minus plus is minus 7, so minus 7. That means the transpulmonary pressure is negative, and negative transpulmonary pressure will allow the air to come inside the lung. That means towards inside during deflation. Now this is another condition, and in this condition, imagine that there is any injury like stabbing injury or something which has punctured the lungs. Now the air is coming inside the lungs, okay, until when the air will go inside the lung, when there will be equal pressure. The pressure outside the lung is 0, and the air will keep going inside the lungs till the pressure inside the lung will be 0. Now the transpulmonary pressure is equals to inside 0 minus outside 0. 0 minus 0 is equal. So there will be what will happen? There will be a collapse of the lungs, and that is why this happens in the pneumothorax. Because the pressure inside the alveoli is equal to the pressure outside, that is intrapleural. And so there is no force that is holding the lungs, and that's why there will be the collapse. Second one is the transthoracic pressure, that is across the thorax. Of course, that means inside one is the intrapleural and outside one is the body surface or the chest wall. Now the outside the chest wall is 0, and at FRC, as we have already studied, that intrapleural pressure is minus 5. Now putting the value minus 5 minus 0 is minus 5, and minus 5 means there is negative transthoracic pressure, and when there is negative transthoracic pressure, the pressure will be inside, the air will go inside. Okay, that means that what's happened in the FRC. That means the chest is trying to exert the pressure on the inside, and the lungs at FRC is trying to pressure on the outside, and it is at the intrapleural pressure is negative, and that's why the lung is at the state where it cannot be collapsed or it cannot be overexpanded. Now the third one is the transrespiratory pressure across the system. 0, alveolar pressure is 0, and the body surface is of course 0, so that means equal. At FRC, no distending or collapsing force. Okay, another term is hysteresis. What is the hysteresis? The hysteresis is the difference between the inspiration and the expiration. The difference is the hysteresis. Now, why there is the difference? Because inspiration requires increased pressure. Of course, a pressure is needed to expand the lungs, and of course the muscles are needed to inspire. But the expiration is a passive process and doesn't need that much pressure. So that is forming this graph, and the difference between the two is known as the hysteresis. Okay, now according to the clinics, you have seen a patient, maybe a patient with emphysema or a patient with fibrosis. What happens in the emphysema? The patient has a lung which has lost its elasticity, and because of decreased elasticity, there will be increased lung compliance, as I have already discussed. That lung compliance is inversely proportional to the elasticity. Now the increased lung compliance means there is increased air. As I already told you that there is increased air inside the lung. That means increased residual volume. And what is FRC? A residual volume plus expiratory reserve volume. So increased residual volume means increased functional residual capacity. Now increased functional residual capacity means there is decreased tendency to lung collapse. That means there is increased expansion of the chest wall, and that increased expansion of the chest wall leads to the barrel shape of the chest. That is why in emphysematous patients there is usually barrel shaped chest. Now what happens in fibrosis? there is increased elasticity, and that increased elasticity leads to the decreased lung compliance. That means decreased residual volume. That leads to the decreased functional residual capacity. That means there is increased tendency of lungs to collapse. Okay, so you just have to remember that at functional residual capacity, inside pressure is equal to the outside pressure, but the intrapleural pressure is negative only at FRC, and that is keeping the lungs not too collapsed and not too expanded, but at a neutral shape. You can remember it simply by remembering that in inside pressure and outside pressure, and there is something that is in the middle. So the ability to collapse and the ability to expand depends on that middle one. So that middle is pulmonary. That middle pressure can be the transthoracic pressure, or that middle pressure can be the transrespiratory pressure. So that middle pressure, if that pressure is negative, the pressure will be exerted inward, and if that pressure is positive, the pressure will be exerted outward. So you just have to put the values in the formula and you will get the answer. I hope this has made this topic a little easier, and if you really like this video, then please subscribe the channel. Thank you.